Okay. Thank you all so much for coming. The the press is such an important component to everything that we do in criminal justice so that we can really communicate our successes and failures, quite frankly. Um, but we're here today because May is Mental Health Awareness Month. And there is really no other issue as pressing and important in the criminal justice space as recognizing mental health and its impact on what we deal with every day. Look, the data is unequivocal. 80% of the people in the Harris County Jail right now suffer from a mental health disorder. A third of the people incarcerated right now in the Harris County Jail are on some type of psychotropic medication. To suggest that that is not the ultimate crime driver that we're facing is just putting your head in the sand. While our county staff at that jail, including the incredible work of our deputies and detention officers and Harris Health and all of the medical providers that are in the Harris County Jail, do an incredible job at trying to get the inmates all of the access to health care and specifically mental health care that they can. I shouldn't have to tell anyone here that a jail cell is not the place to treat, to help, or to let people recover from a mental illness or an addiction. And we all know that both of those two marry each other so much. You have so many people that begin using narcotics and other types of drugs to self-medicate an undiagnosed mental health issue. So we've got to get better about what we do around treatment. And quite frankly, once people are locked up, in many cases, it's too late to get them the treatment and the help that they need. But there's good news. Since January, we've begun a shift inside this office. And it couldn't be the shift that we've already seen in success without the incredible partners that I have standing here with me. The commissioners giving an unprecedented supplemental, quite frankly, emergency budget increase to this office of $7.8 million, $3 million of which is going directly to our new Mental Health and Diversions Bureau. We have already begun the hiring process of more than 15 additional prosecutors, healthcare workers, social workers inside the Mental Health Bureau to begin to tackle this problem. And again, we are in constant communication with the sheriff's office who runs our jail, and just so we can really begin to approach this holistically and differently. Since January, we have diverted more than 340 people away from incarceration into specific mental health treatment programs, many of which are run by our incredible Harris Health Director. We have a new staff member full-time at the Joint Processing Center, which is the intake part of the Harris County Jail. And again, that is directly because of the support that we have from Commissioner's Court. This was a brainchild of Commissioner Garcia years ago that was never fully staffed and funded. But since January, because we have had someone there being, quite frankly, the last line of defense to be able to say that this person is in mental health crisis, we've got to take them to a different location in the Joint Processing Center in the Harris County Jail. Over 340 people have been diverted to mental health treatment instead of incarceration. The number that I am the most proud of, the number that I think is indicative of everything that we've done around mental health and around just reimagining how we go about prosecuting cases, is our jail population is down a staggering 9% since January. It hit its high February 2nd of 9,905 inmates. As of this morning, we are at 8,961. We are below 9,000. We are almost below pre-COVID numbers of people in that jail. There's so many reasons that that's important. There are just so many, but the one that we can point to that is directly impactful for the taxpayers, for the people of Harris County, is that the taxpayers are paying $54 million a year to outsource inmates to private prisons in different states because we're so overcrowded. That is going to stop. That is going to stop in short order. And it's not because we're releasing violent criminals back into the public. It's not because we are just not accepting charges. It's because every single person in this courthouse, from the judges to the bailiffs to the prosecutors, are working round the clock. We have tried, and I want to make sure I get this number right, we have tried more than 230 cases in this building since January 1st of this year. That is unprecedented. We have tried 57 crimes against children. We've tried 12 adult sex crimes. We've tried 5 human trafficking and internet crimes against children. And we're in May. No one who understands this system believes that there's any other real way to tackle a backlog than to try the cases. Getting in there and trying the cases makes every case behind it get to their day in court in a meaningful, faster way. That's justice for the victims. That's justice for the accused. That's justice for the community. That's what we're doing, and that's why you're seeing our numbers go down. There's a lot more to do. We're not there yet. And quite frankly, in a job like this, in a building like this, you can never be satisfied. You've got to continue to innovate. You've got to continue to reimagine what it looks like, because the system as it sits right now is broken. And so we've got to continue to work through it. But it can't be just me. It's got to be this incredible group of stakeholders that we have. And I'd be remiss if I didn't talk about the judiciary. We can't try the cases that we're trying right now without their incredible efforts. We couldn't be doing the things that we're doing right now without the judges at every level, from the district courts to the county courts to the magistrates. They are all putting in the work day in and day out, and I know they don't get the credit very often. So we need to be appreciative of all their work, and not just the work they do in their courts, because we have all of our specialty courts. We have our mental health courts. We have our STAR courts, our drug courts, our veterans courts. Those judges don't get any extra money. They don't get any accolades for doing that, but they all do it on a volunteer basis. So without them, this doesn't work, and it is working so well right now in large part because of them. All right, let me close by going back to mental health and the stigma that is around mental health. I think that our county judge has been so courageous for talking about her own struggles and helping to remove that stigma. But the stigma is a huge component to all of this, for people not seeking help and treatment when they need it and before crisis comes. We lost 4 incredible members of the sheriff's family and our law enforcement family as a whole this year alone. 2 mental health struggles. William Bozeman, Christina Kohler, Maria Vasquez, and Long Nguyen. These were the heroes that protected the most vulnerable of us while they were suffering in silence. We've got to do better for them. This is a issue that is very personal for me. As many of you know, when I was 15 years old, I walked up the steps at 1301, the old Harris County Jail, right next door. And I bonded my mom out, not because she was a violent repeat offender, but because she was charged with possession of a controlled substance, a felony. I watched her after that eventually succumb to the addiction. And as I know now as an adult, she became an addict, and she started down that path in large part to self-medicate and treat an undiagnosed mental health issue. I can only begin to think about how her outcome could have changed, how all of our outcomes could have changed if she had come into contact with a criminal justice system that actually recognized that mental health and addiction are diseases, as opposed to something to just warehouse and throw human beings away. And I'm not going to be a part of that. So we are going to reimagine it. We are going to be aggressive in treating and helping people where appropriate, so that we can have the bandwidth to focus on the people that need to be prosecuted. Thank you all again so much for coming. And now I'm going to hand it to Commissioner Adrian Garcia.
Thank you. Thank you. Good morning. Thank you, District Attorney Teare, for your leadership. And I want to also acknowledge the respective leaders that we have here. From Commissioner Briones, who has been an incredible champion of the criminal justice system, making sure that at every level of court, whether civil, misdemeanor, or felony, that it is working at its optimum level. And so I just want to appreciate her and her investments and her work on that. And then the Sheriff's Office, without a doubt, the men and women in law enforcement, regardless of agency, is always dealing with the issue of mental health challenges on the streets across Harris County, and we appreciate everything that Sheriff Gonzalez has done to advance policing efforts as they relate to those with mental health struggles. And then our executive director at the Harris Center, making sure that he and his clinicians are always there, around the clock, folks, around the clock, on holidays, during natural disasters, after horrific events. The men and women of the Harris Center are always there to help provide compassion care and access to those treatment facilities and programs that will help them have a better day than they were previously having. So, Wayne, thank you for your leadership. But I too want to also acknowledge that we are here on recognizing the Mental Health Month. And but reality, as the district attorney has touched on, every day should be an opportunity for us to work to ensure that those who are struggling, especially those without the resources, those that are uninsured and underinsured, who have to depend on public services to get the treatment that they need the most. And so, again, the applaud and respect for the men and women at the Harris Center is second to none. And my effort here is simply, as the district attorney said, is that when I once served in the role as a sheriff of this county, it was all too obvious. And what's really fascinating, folks, is to point out that in my tenure, I had 10,000 inmates in my custody. 2,000 were being shipped to the state of Louisiana, almost at a similar cost, about $60 million that it was costing taxpayers. And similarly, at that time, as the district attorney mentioned, 30% were on psychotropic medication. And I am so proud of my efforts to work with the district attorney, with the support of my colleagues on Commissioner's Court, to provide the necessary investments so that we could do better, as the district attorney has mentioned. Do better at the front door of the county jail, because the county jail is not where people who are sick need to be. Most of those people on psychotropic medication are simply broken. They're not a true danger to our society or to the community, but they're broken, and they find their way through a revolving door back to the county jail. And so our work to ensure that they're getting the treatment that they need the most is critical. Because not only does it help them, but as the district attorney mentioned, it makes us safer. It improves public safety in Harris County when we can deal with those who are true dangers while being compassionate with those who need treatment and medicine and other resources instead of a county jail. And so I just want to acknowledge that the efforts of the district attorney should be taken notice by all, because not only does this help people, not only does this make our county safer, not only does it get people out of the county jail that don't need to be there, but to anybody who is watching their pennies, like every one of us are, it saves the taxpayers money while accomplishing all of those other goals. It saves the taxpayers money, it makes the county safer, and it helps people who need the services the most. And so again, Mr. District Attorney, thank you for your leadership. Thank you for the dedication and commitment of your men and women who are at the helm every single day. And again, to anyone who is struggling, let today be heard by all. We got your back. The Harris Center is there to help you. If you have a friend or a loved one who is needing help, please, please reach out. Reach out before they find their way coming to the county jail or possibly worse. Let's be a community, the community that we are, to make sure that we are helping everyone around us find the right door to walk through to make their days better. Thank you again. And again, Mr. District Attorney, thank you so much. And now, Commissioner Bidones.
Yes, thank you. I'm so proud to be standing up here with incredible partners. First, DA Teare, thank you for what you and your team are doing to advance justice every day. And as a fellow lawyer, I'm energized by the fact that trials are up approximately 30%. You're holding those who need to be held accountable, and you are working strategically and effectively and compassionately in connecting others who need resources with resources. And so the strategy and the expertise and the heart that you're bringing to this office is incredible. And I know your mom is smiling down from heaven with immense pride at the positive impact you're making. And to all your team, thank you. To my amazing colleague, Commissioner Garcia, or former Sheriff Garcia, thank you for your partnership. Thank you for always prioritizing public safety. We are fortunate to have your leadership in Harris County. And to our CEO of the Harris Center, Wayne Young, everything you and your team do on the front lines to treat mental health and mental illness here in Harris County, we appreciate you. And to Sheriff Gonzalez and to Chief Diaz, thank you for your partnership. Thank you for being a law enforcement partner that believes deeply in keeping our community safe, but also doing it in a way, again, with strategy and with heart. so that we are being good stewards of taxpayer resources and keeping everyone safe. So the balance y'all strike is really remarkable, and I appreciate you. So I stand here today reflecting on May as Mental Health Awareness Month. We all know somebody we love, somebody we know who is struggling. And we pray that those individuals don't intersect with the justice system. We pray that they don't end up in our Harris County jail if they don't need to be there, because we all know that we have so much work to do in Harris County. We know that our Harris County jail is the largest mental health facility in the state of Texas and one of the largest in the United States. That is not justice. So today we are here talking about how we are doubling down in advancing justice while advancing public safety, while advancing good government to make sure that our taxpayer resources, that we're laser focused. If somebody is not a threat to our community and needs to be connected to resources, we're doing that. If they need to be held accountable, we are doing that. If we have individuals, as we do and as is increasing, who are waiting for their competency assessment, we know that they're waiting. We know that between 2020 and 2023, there was a 40% increase in competency cases. And those cases had approximately a 20% longer length of stay in our jail, which then exacerbates and makes us wait. It makes the victim wait for their day in court and justice to be served. It makes the accused wait. It makes the backlog be exacerbated. It makes the outsourcing problem exacerbated. Meanwhile, we're waiting for state hospital beds. So Commissioner's Court has been proud to be a partner in investing strategically. For example, with regard to the Harris Center, augmenting the number of beds we have for this competency restoration, investing approximately $2 million to add beds, to add capacity, so that those individuals can be assessed to be competent, restored, or if they cannot be restored, then next steps. This has also helped reduce the long wait for the state beds. And so again, laser injecting taxpayer resources to advance justice, advance safety, help our victims, and help those who are accused. We were so proud, Commissioner Garcia and I, to be there in April 2025. I know our teams. I want to thank our Precinct 4 team, Precinct 2 team, the DA's team. We worked together for months on this strategic investment in our district attorney's office, which we were so proud to champion and vote in favor of. The approximately $8 million in additional funding, with a substantial portion to be spent on a mental health bureau. Again, using taxpayer resources to advance justice, safety, and better outcomes. So we will continue to invest strategically because we want to make sure Harris County is serving all, is advancing justice, is advancing public safety. And I'm proud to be here as a commissioner and as a lawyer and former judge, but most importantly as a mom, which to me it all goes back to home, right? So if one day my daughters struggle with mental illness, I want them to know we have the Harris Center. If one day they get caught up in trouble and they're not a danger to society and they need competency to be restored, we know that we are being as strategic as possible. And most importantly, we want our families to be safe. And this is a way that we can, again, double down on those who are violent and who are a threat while helping those who are not. This is a both-and approach to justice and safety. And I'm proud to live in Harris County, and I'm proud to continue this work because we have a long road ahead. But I'm confident that if we come together as a community and focus on solutions and ways we can move forward, we will end up in a better, safer place for all of our families. So thank you. I'm proud to be here. And again, DA Teare, it energizes me to my soul to have you at the helm, advancing justice every day alongside these amazing partners. So thank you.
Okay. I think next we're going to go with the CEO of the Harris Center, Wayne Young.
Good morning. So I am Wayne Young. I have the privilege of being the CEO of the Harris Center for Mental Health and IDD. And I appreciate the recognition of Mental Health Awareness Month. I will tell you, for the 2,600 employees at the Harris Center, every month they're focused on improving and increasing awareness around mental health. I say I'm privileged to be the CEO because I get to work with one of the most talented group of behavioral health professionals that I've ever met. We are, for those not aware, we are the public mental health system for our community. At the Harris Center, we believe behavioral health should be accessible, proactive, and community-based. And those principles extend to how we support individuals who interact with the justice system. Far too often, people with behavioral health needs are caught in a cycle between the streets, emergency rooms, and jails. And we're here today because we know, and all of our partners know, there is a better way. While critically important, criminal justice diversion isn't just about reducing jail populations. It's also about building a true continuum of care to help meet people where they are. That means offering services early, often, and in the right setting. It means recognizing treatment is an important and effective response for individuals facing criminal justice involvement as a result of their behavioral health needs. Through our partnership with Harris County, the District Attorney's Office, Harris County Sheriff's Office, Houston Police Department, and other law enforcement agencies, judges, and community providers, we're able to advance several innovative and nationally recognized programs that help reduce the criminal justice footprint in the lives of those with behavioral health needs. Our crisis call center answers 175,000 crisis calls a year. Half of those are received through the recently established national 3-digit code that can be dialed from anywhere in our country, 988. You'll hear me come back to that again. It's a resource that I want to make sure is repeated and out there. Additionally, our Respite Rehabilitation and Reentry Campus, which was funded in large part from Commissioner's Court, provides programs offering an alternative to jail for individuals with in a mental health crisis who would otherwise face arrest for low-level offenses, and facilitates transition back into the community. We've had almost 900 diversions from jail so far this year, while also temporarily sheltering and providing jail reentry supports for hundreds of unhoused clients with mental health conditions. Our crisis call diversion program, where we embedded crisis counselors in the 911 call center, has responded to almost 7,600 calls to 911 and diverted 60% of those away from any emergency response in the last year, because the callers were experiencing a crisis and not a crime. This is accomplished through our de-escalation and our non-law enforcement response teams. Our clinician and officer remote evaluation program, originally championed by the Harris County Sheriff's Office and Commissioner Garcia, he helped us secure funding for the expansion of that after the pilot. It has responded to thousands of calls by connecting law enforcement officers from dozens of different agencies to our crisis counselors. Our counselors provide a curbside crisis assessment via our telehealth platform from tablets that are provided to those law enforcement officers. Those numbers don't include the more than 24 co-responder CERT teams that we have, where our mental health clinicians ride along with Harris County Sheriff deputies and other law enforcement agencies to respond to crisis calls throughout our community, which is one of the largest and longest standing such partnerships in the country. Sometimes diversion isn't an option, and when that happens, these commissioners and the other members of Commissioner's Court have made it a priority to fund mental health services in the jail, the Community Assistance and Resource Program, the Jail-Based Competency Restoration Program that Commissioner Briones has championed, and a multitude of other services and supports to help support and accelerate progress through the criminal justice system for those with mental illness. For lasting change, we need a system that supports people across every step of their journey, whether that's with reentry navigation, housing supports, peer services, or other therapeutic approaches as a part of a full continuum of care. We've learned through these programs and others that when we invest in people, we reduce recidivism, we improve public safety, and we create a healthier, more resilient community. I want to thank our partners for standing with us in this work. Together, we can continue to build a system that truly transforms the lives of people with behavioral health and IDD needs. And as I wrap up, I said I was going to, I want to circle back to 988 and encourage that everyone in here, regardless of your role, do what you can to promote and increase awareness of this life-saving resource. Thank you for your time today.
Okay, I don't know how I became the MC, but we're going to do this. Next, we're going to hear from Executive Chief Deputy Tommy Diaz. I've just known him so long. So, Tommy. Thank you, brother.
Good morning. I'm Tommy Diaz, Chief Deputy of the Harris County Sheriff's Office. It's an honor to stand up here with these incredible partners today, talking about a very important issue that affects everyone, regardless of socioeconomic status, where you went to school, what zip code you live in. Mental health affects everyone. And I especially want to thank the district attorney, Sean Teare, today. After he was sworn in, I don't know if we were the first call or the second call, but we had a meeting scheduled for the very first day that he was in office to talk about this very topic. So the reductions in jail population as a result of their efforts on trying cases on diversion was intentional from the first day. The over 300 folks that have been diverted were done in conjunction with the district attorney's office. So I want to thank him and his team for the effort and the coordination that they've coordinated with us. We call it, like, literally on a Friday night, I can call them and they're going to answer. On a Saturday, I call them, they work all night. So I assure you that when you talk about public servants, this team is above everyone. Just a few facts to hit on. When you talk about trying additional cases, that moves folks out of the jail faster, right? And so just a quick reference, we probably hovered around 400 inmates who were paper ready, which means that they're ready to go to TDC. That number today is about 700, which indicates that the folks in this building are doing their job effectively. And it also means that folks are getting out of jail that don't need to be there because they have been found innocent or not guilty. So hats off to your team for the pursuit of justice. I'd like to thank Wayne Young as well. When we talk, and I'd like to just give you an example, we had a snowstorm this year, right? Unprecedented. His team was there. You know, everyone at the sheriff's office is sleeping in offices and making sure that the folks we're responsible for are taken care of, but so was his team. So hats off to you, sir. Thank you very much for that. Wayne Young's an incredible partner. I'd also like to highlight that this is Police Week, where we honor fallen deputies. And the reason I bring that up is because the commissioners have been an incredible partner in honoring the deputies. One area specifically that has maybe gone unnoticed, but it is important to us, is their effort to enhance mental health resources for our own staff. And so over the past several years, we've grown the Behavioral Health Division, which is there to serve not just Harris County Sheriff's deputies, but all deputies and even our partner agencies. So thank you all very much for providing funding for that and helping coordinate that. And Wayne, you've given us a lot of guidance there too. And I just want to give y'all one more anecdote to tell you about how things have changed in the county. When I was a rookie, there was one call in particular that stands out to me. This person was definitely going through a crisis, a mental health crisis, but we didn't have the tools to kind of divert him to where he needed to go. His family was scared. There was crying. There was broken things across the house in a room much smaller than this. And I think it sticks out to me because this man was he had memorabilia from my college on the wall. And so there was nothing different between him and I except what was going on in his heart and what he was suffering. And so I look back on that and I think about him and say, what could we have done today? And there's so many more options and more things that we could do. And so just acknowledging all the people in this room who are helping move that ball forward and removing stigma about mental health. So thank y'all to everyone in here. I assure the public that we are working together, that we are collaborating, that we're communicating, that we're coordinating, and that's what is gonna move the ball. And so today isn't a victory lap. Today is step one. And so I look forward to the continued relationship with the commissioners, with the DA's office, with Wayne Young, and there's so many other people that aren't up here that just do so much good work. So hats off to everyone. I'm gonna just read one thing in Spanish. Don't laugh at me, Commissioner. So, hola, soy el subjefe Tomás Díaz de Harris County Sheriff's Office. Gracias por estar aquí. Mucha gente cree que solo queremos arrestar, pero no es así. Queremos ayudar a las personas con enfermedades mentales. Desde enero, más de 340 personas han recibido ayuda en lugar de ir a la cárcel. La cárcel no es un hospital. Muchas personas ahí están enfermas y necesitan tratamiento. Trabajamos con otros líderes para cambiar esto. Queremos una comunidad más segura y con más compasión. Thank you.
Sí, lo siento, yo hablo poquito español, pero I do have, and I'm already exhausted all of my Spanish, I have two incredible commissioners that are going to give at least some sound in Spanish for anybody that needs it.
Please, please. Buenas tardes, estamos aquí para reconocer que este es el mes de reconocer la salud mental, pero mi comentario anterior fue que debemos tomar cada día alrededor del año para reconocer que hay personas que están sufriendo con alguna enfermedad. Y aquí estamos junto con el procurador del condado, Teare, para reconocer que la cárcel, como dijo el jefe Díaz, que la cárcel no es el lugar donde esas personas deben de estar para recibir el tratamiento que ellos merecen. Por eso le damos las gracias a Wayne Young, la persona encargada del centro, el Harris Center, el centro donde llegan a ubicar los servicios y el tratamiento para personas que están sufriendo con alguna enfermedad de salud mental. Pero también estamos aquí para reconocer que el trabajo por parte de la comisionada Leslie Briones, que ha trabajado sumamente fuerte para asegurar que el sistema de justicia en el condado está trabajando como debe para cualquier persona. Y en una de esas partes es que las personas que están entrando a la cárcel, con el apoyo que ella y yo y otros hemos dirigido al procurador, está ayudando que las personas que están enfermas, pero no son personas peligrosas, que lo estamos redirigiendo al Harris Center para recibir la ayuda que ellos necesitan. El procurador está aquí anunciando que 342 personas se han redirigido a los servicios y el tratamiento, la medicina que ellos necesitan y que esa ayuda no está en la cárcel. Yo le estaba comentando al procurador que si llegamos a calcular que por lo tanto una persona está pasando alrededor de 180 días en la cárcel, esas 342 personas que por lo tanto cuestan aproximadamente $300 para tratarlos y algunas veces mucho más, a lo menos el procurador está ayudando a ahorrar más de $19 millones en el tiempo que en redirigiendo esas personas afuera de la cárcel. Eso es importante porque ese es dinero que podemos también aplicar a otros servicios de seguridad pública. Entonces, lo que está haciendo el procurador no solamente está ayudando a aquellas personas que están enfermas, pero también está ayudando a que el condado llegue a ser mucho más seguro y obviamente está ayudando que podemos ahorrar el dinero para aplicarlo en otras formas que nos ayuda a seguir haciendo un condado mucho más seguro. Gracias.
¿Preguntas? In inglés, por favor. No. Before we do take questions, I want to recognize Cheryl Chappelle, who is our bureau chief over our mental health bureau. She is very mad at me right this second because I'm recognizing her, but she's wearing green for mental health, and I got to tell you, I don't think there's anyone that's working harder right now that is on the phone with Wayne and Tommy and not sleeping and calling me at 3 a.m. about an idea she has. So thank you so much for agreeing to come on and do this. Now, questions.
You guys described a lot of services available for people. How does someone, though, like Parnell Bland, be accused of shooting a precinct 1 deputy? How does he fall through the cracks when there were services that he probably would have been eligible for?
So, look, he has now an extraordinarily serious pending case. So I don't want to get into specifics around what happened with him, but in general, that kind of case is exactly what we're talking about. We are on the very beginning of this. We have diverted over 340. We should be diverting so many more. We need to have a legitimate lockdown, step down facility where we can put people, not the Joint Processing Center, not Harris County Jail, for people that are arrested for criminal trespass or criminal mischief, where they can be locked up for more than the 24 hours before they're out on a personal recognizance bond as required by federal law, that can be detained so that they can be stabilized into a step down facility for 60 or 90 days, to have the resources surrounding them that are actually there to stabilize and put people on a different path. Had this been in place, had we been able to do something like that, then maybe Sheila's not shot. Maybe we're not at a whisper away from a mass shooting in downtown Houston. So yes, we are, and I think that is the big takeaway here. We're working incredibly hard at this, but we're in nowhere close to being where we need to be, right? 340 is great. We got 9,000 almost people in there, 80% of them that are struggling with a mental health deal. So yes, we know that there are going to be continuous issues in reimagining, and it's one of the reasons that I think Cheryl Chappelle sleeps about an hour a night, and I don't know if Tommy's been asleep in 3 years. So I get it, trust me, and without going into specifics, we know, and every one of these is a learning experience so that we can get better at it. But we've got ideas. If anybody else wants to touch on that, feel free.
I just want to add the stigma that we barely touched on. It's a critical issue, and I would ask all our partners in the media to help talk about that more, to help normalize mental health treatment. The commissioner and I have been working tirelessly to lift that issue, and that really does prevent people that we have probably seen in these type of circumstances, that if not for stigma, they may have not accessed treatment that could have prevented this whole thing from ever happening. And so we need help in that regard, because Wayne and his team absolutely work incredible magic with the people that they're treating. And just remember that the human mind is an incredible thing. And when it does break down, we need people like Wayne and his team to be available for those individuals. But if people don't access those services or think to call 988, then we're going to have more of these circumstances to talk about, regrettably. But we need to make sure that people understand that it is okay. Health includes your blood pressure and your mental well-being.
And Nicole, I just want to say, this is such a passionate case and issue for me. That's an important question, and one that I'm glad you asked. I don't want anyone to take my passion for being angry at the question, because it's something we have to ask, and we've asked internally. So thank you.
DA, you mentioned that there's a full-time employee now at the jail, and that's a big part of the 340 plus people being diverted.
Right.
Can you take us through that process and how that's now different versus before that employee?
Yeah. I think we might have a couple of answers to this, but yes, absolutely. It is, and Tommy can give you, Chief Diaz can give you the layout better than I can, because I've only been over there 700 times. But there is a desk at the entrance point of where people that are getting processed through the Joint Processing Center. There's a desk right there, okay, and it is now staffed by an assistant district attorney, not on Zoom, not anything, where they get to see, smell, all of it right there, the individuals as they're coming in to be processed. that is the goal. So officers, before they can, and it's not just the sheriff's department, any police agency that is arresting anyone in Harris County has to walk past them and present to that ADA before they can book someone into the jail. So that's why I said it's the last line, because we see a lot of times where an officer on the scene will call intake and say, I think this person's in mental health crisis, and then we'll talk through what the appropriate diversion, if there is an appropriate diversion. But sometimes the crisis can manifest the second they get to the jail or whatever. And so you've got that last line of a prosecutor there who can be the authorization to divert, even if a prior prosecutor just over the phone without being present authorized an arrest. And so it is an additional safeguard to make sure that we're not locking someone up that is truly in mental health crisis. We're not saying that we're not going to file the charge. We're just saying that we're going to pause and get this individual stabilized. And so that's, if I missed anything, guys, it's almost like I've done this a while.
The one thing I do want to add to it is that this program was in place prior. However, it was only staffed with a person on one shift. On that shift, you could see a significant number of people being diverted. On every other shift, there was a dramatic difference because it was done virtually. And so when you have someone physically there, it makes all the difference. I'm confident that if we had kept the same model that we had before, we wouldn't have 342 people to talk about today.
Another question for you. You mentioned the rates of inmates right now, incarceration rates, right? They're down 9%. You also mentioned that right now taxpayers are paying up $54 million to move inmates to other states because of space. For lack of a better term, what is the magic number that we can house here in Harris County without having to ship people and inmates out?
That's a great question. One particular fact that we also spend a lot of money on overtime. So we're meeting ratios and we're doing those things, but at the cost of overtime. So the court last month authorized 150 new detention officers. So the goal right now is to stabilize what we have, the number of inmates that we have to the overtime, which reduces cost. So we are well on our way to completing that task, and then at that point we'll be able to start returning inmates that are outsourced back into the Harris County Jail. So, but it also, we have to acknowledge that we have cases that are moving. We have people that are being diverted. And all of those things are allowing this to happen. So,
But jail population-wise, the number is somewhere in the 8,000 heads.
correct. Yes, sir.
And another data point that quite frankly the media should be looking at pretty routinely for us, because it's something that keeps this office and this courthouse honest more than even just total number of population, is average stay in custody, right? And we have decreased it significantly, and I bet you Chief Diaz can rattle it off, but we've decreased it. But average stay in custody per inmate, it reflects everyone that is given a personal recognizance bond within hours, all the way up to, until recently, the person who had been incarcerated for 18 years. And so we are so grossly above the average around the state in Harris County. I mean, like 5, 6, 10 times almost how much. And so that is a number that my team is looking at regularly, because it's one that we control almost uniquely, right? The DA's office and this courthouse to a whole, but we're the ones that push cases to trial and try cases and dispose of cases in a meaningful time frame. And so that's something that look, every time y'all ask us about jail pop, I would really like to hear, and what's the average stay, because it's something that we can point to directly and that we need to keep ourselves abreast of as well. So
Do you know what
Tell me.
185 days.
185 days.
And that number
What
has
is-
reduced, though.
And Chief, can you share what it should with the?
Sure, the rest of the state is probably averaging like 30 to 40 days on an average length of stay. So we're multiple times over that. But that number has reduced. And so that is a primary driver of what, or a key performance indicator that we monitor regularly. Not just because of, and just, not just because of cost, but also when we talk about mental health, the longer you're here, right, the more stressed out you get. The folks in our custody are. The feeling of maybe hopelessness starts to creep in. And so now we need to call Wayne more often, and it's just building on each other. So the faster we get people out of jail, they don't need to be there. If they're innocent and not guilty, like, we've got to get those folks out of there. So hats off to the team for doing that.
One thing I want to add to that, back to the taxpayers, we're trying to do some calculations. This is all just very rudimentary. But remember what was just said, that the average stay is about 185 days. In my time, it was 30 days. The average, the cost for a healthy inmate, it used to be about $70, $75, probably with inflation and all, probably, let's just say 85 bucks. The cost for someone on psychotropic medication used to average about 300 to 400. So these 342 folks that are no longer in the county jail, assuming that they would have been in jail for 185 days, the district attorney and his efforts have saved the taxpayers nearly $19 million with the redirection of these individuals for not coming into the county jail. Significant.
If I can just add, so we did an evaluation of our jail diversion, and for every dollar that the community has spent on diversion, it has saved $5.54 in criminal justice costs. And that's district attorney staff, it's judges, it's public defenders, the whole gamut, but it is a five-fold return on that investment.
All right, we're just going to keep doing this until. But I do want to point out, as Courtney Fisher, my director of communications, would be very angry if I didn't. Our dashboard is still up and running, and it is something that we're working through to make it more effective, more truly transparent. But in a broad way, the information is there for people to continue to monitor this, because I don't think there is a bigger story in our area right now than the Harris County Jail, in all of the facets of it. So, we've got people bussed to different places. We've got, a gross understaffing because we are backlogged. So it's something that I invite all the media to kind of play with and learn through. So.
Good deal.
Yes, ma'am. Just one?
But can you describe the 340 cases? What kind of cases are they?
This close.
The majority of them are low. The majority, if not all, are low-level nonviolent offenses. They're misdemeanors. At this point, I've talked to Wayne and Sean several times about what we will do inevitably with the higher-level cases that are obviously in crisis, but for now, the cases that are being diverted are low-level nonviolent.
Because I want to point out, when we have someone that we arrest for, let's say, a criminal trespass, that is in mental health crisis and is almost immediately deemed incompetent before they can even appear in front of a magistrate. Now, instead of someone that would have gotten out in 12 to 36 hours, they're incompetent. They now have to remain in custody in the jail restoration part of the jail until potentially we have to send them to the state hospital to restore competency. So we could be talking about months and months and months, potentially years, on a Class B misdemeanor where the largest punishment you could ever get is 180 days in jail, because we didn't get them the treatment on the front end in order to deal with this. So when you're talking about both justice and the right thing and cost to the county, it only makes sense to go get them, recognizing that it is a health issue, get them the treatment that they need on the front end, and then decide what, if any, criminal charges should come in on the back end. And we have so many of those coming through the jail. It's one of the reasons that 185 days is almost wishful thinking on a lot of these cases.
Can you describe again, when they're diverted, where exactly are they going and what's happening?
So I'm gonna probably botch this a little bit, and then Cheryl can come and fix it. But a lot of them are being taken to the organization and the building that Harris Center runs. There are other stakeholders, including hospitals, that we are diverting people to, depending on the need of the individual that we're diverting for, that's in crisis.
Yes, that number of diversion is for Wayne's program, the Diversion Center at 6160. At that location, they have specific beds for diversion. They have specific beds for reentry, which is people that are leaving the Harris County Jail and needing resources and help getting back into society. There's also a step-down program there, and he has some housing that's coming. It's beautiful over there. You should go. But that's where that number comes from. There are other ways that we are diverting people sometimes, but it's not a full, true diversion. It's usually a post-charge trying to get them treatment.
Okay. Thank you all so much for coming.